Okay, good morning, everyone. So today we will be discussing about the clinical features, okay, which was already given to you all by your Shaban ma'am. Now you just take out your notes. So from there, whatever you want to ask me, any point that you did not understand, anything like you can ask me. So all of you take out the notes. All of you have the notes, right? Yes or no?
Yes, ma'am.
Okay. All of you, can you see the slide?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay, so you just check your notes also, okay? Because like there might be some spelling mistake or anything in the notes, even though the PDF was given, but still you can just check the slide that I make. There is not even a single mistake, so you can just match it. So the clinical features. So when your ma'am explained about these clinical features, all of you were clear about these clinical features, or else you were not clear?
Not clear, ma'am.
All of you? Only one is not clear. What about other? All of you are clear, right? The rest of you?
No, ma'am.
No, ma'am.
No, ma'am.
Okay, okay, so let us start. So if someone have a kidney stone, okay, if someone have a this renal stone diseases, okay, then what type of clinical features, that is what type of sign and symptoms he or she can have. So first is occult passage of asymptomatic stone may occur. Occult passage of asymptomatic stone may occur. More frequently, however, asymptomatic renal stones are identified radiographically during evaluations of others unrelated conditions. So, do you know the meaning of occult, or double C-U-L-T? Or double C-U-L-T?
No, ma'am.
Okay, occult means like how will I explain? Occult means like hidden, okay, hidden. It's hidden. You know the meaning of hidden, right? H-I-D-D-E-N, hidden.
Yes, ma'am.
Okay, so hidden passage of asymptomatic stone may occur. उसका मतलब है कि like this the hidden stone, okay, hidden passage of asymptomatic stone means the stone is not symptomatic, okay, the stone is not symptomatic, so there will be passage of stone, okay, there will be passage of stones, but that passage of stones will be hidden, so that type of features might occur. Means like there is a stone but you can't feel but you can't feel, but it is asymptomatic, दिखाई नहीं दे रहा है, so it is asymptomatic. So that kind of that kind of passage or features you can get in a person. So that is occult passage of asymptomatic stone may occur. Or simply you can call like this, that there was a there was a passage of stone, but that passage of stone was hidden. Why it is hidden? Because the stone that was present was not symptomatic, it was asymptomatic, you cannot feel or you cannot see. That is why that type of feature can also be like seen. So are you clear with this point? If not, I'll explain again. Occult passage of asymptomatic stone may occur. Because when what happened is that sometimes what happened is the stone used some people have a large stone, some people have a small stone. So when the stone is very small, and that might not cause symptoms also, but that stone, the passage of that stone means suddenly like you find a passage of stone in your urine and all. Suddenly symptoms तो दिखाई नहीं देगा, लेकिन you excrete out or urinate out the stone, all those kinds of passages you can also see. So are you clear with this point?
Yes, ma'am.
Yes, ma'am.
Okay, more frequently, however, asymptomatic renal stone are identified radiographically. Obviously, तो यहाँ पे first में क्या mention किया था? Occult passages of asymptomatic means asymptomatic means you cannot feel or you cannot see or something. Na? The symptoms cannot be seen. So that is why what happened, in order to see all these asymptomatic, जो symptoms को दिखाई नहीं देता है, तो उसको कैसे इन्वेस्टिगेट या फिर उसका रिजल्ट को कैसे आइडेंटिफाई करता है विद द हेल्प ऑफ डायग्नोस्टिक इवैल्यूएशन ना. सो दिस एसिम्प्टोमेटिक रीनल स्टोन, जो एसिम्प्टोमेटिक रीनल स्टोन है, दो स्टोन इट कैन बी आइडेंटिफाइड रेडियोग्राफिकली, ओके, ड्यूरिंग इवैल्यूएशन. दैट इज जब डायग्नोस्टिक इवैल्यूएशन करते हैं ना, जब इन्वेस्टिगेशन करते हैं रेडियोग्राफिकली, then you can identify, oh, the stones are present even though the symptoms was not there, but means asymptomatic renal stone were present. In that way, you can identify along with other unrelated conditions. So, are you clear? Are you
Yes,
clear?
ma'am.
This kind of feature you will see, okay? All of you?
Yes, ma'am.
Okay, next, number 2, hematuria. Hematuria, hematuria. Every one of you know what is hematuria. Darshana, what is hematuria? Again.
Blood in urine.
Okay, blood in urine. Okay, hematuria always accompanies stone movement within the urinary tract and may be microscopic or gross. Hematuria may occur with or without pain. This point is very, very interesting. Hematuria always accompanies stone movement within the urinary tract. So what happens is that when the stone, okay, when the stone are present in her urinary tract, okay, the urinary tract consists of what organ? Ishan, urinary tract consists of what organ? You have upper urinary tract, lower urinary tract.
Name kidney, urethra, and bladder.
Yes, very good. Okay, so when the stone are present within this urinary tract, okay, hematuria always accompany stone movement within the means when there will be movement of the stone, when there will be movement of the stone within your urinary tract, okay, it might be in your urethra, it might be in your kidney, it might be in your bladder or wherever in the urinary tract, okay. When stone जब urinary tract में movement चला जाता है, okay, on that movement, while जब रास्ते पे, on that movement, what happened? The stone, there are different kind of stone. I have shown you all, na, calcium stone, struvite stone, all these. Some stone are very, very sharp, okay? They are like corner are sharp. So what happened is that it might cause inflammation and all. So through that, there might occur like bleeding. So जब bleeding ऐसा होता है, जब stone urinary tract में move करते हैं, तो क्या होता है कि like वहां पे अगर कुछ थोड़ा सा slight सा inflammation ऐसा कुछ हुआ, तो that can cause bleeding. If there is a bleeding occur in the urinary tract itself, then you will see a sign of hematuria, that is presence of urine in your blood. So that is what you see. Means it says, okay, and it may be microscopic or gross. So microscopic or gross का मतलब है कि hematuria will be present, okay, hematuria will be present when there is a movement of the stone in your urinary tract. But what happens is that sometimes the hematuria, जो है, it might be gross, okay, it may be gross. Gross means what is gross? Gross means which you can see with your naked eyes. Suppose now you went to the bathroom and you urinate. When you urinate, what will happen is that you see the presence of blood in your urine itself with your naked eyes. Microscopic means there is a presence of blood in your urine, but you cannot see with your naked eyes. You have to like collect the sample of your urine and then you have to go to the lab, okay, for investigation. Under the microscope, they will observe. Then only they can find out that there is a presence of this blood in your urine. That is the meaning of microscopic or gross. So when this hematuria occur, okay, when hematuria occur, what happens is that hematuria, जो presence of blood in the urine, it might be painful or it might not be painful. Pain हो सकता है या फिर नहीं हो सकता है. It means it depends on the types of stone, what type of stone movement occur in your urinary tract. So are you clear with the second point, or you want to ask any questions? Second point.
Yes. No.
All of you.
No, ma'am.
Okay,
Clear, ma'am.
समझ में आया सबको? All of you understand?
Yes, ma'am.
Yes, ma'am.
Yeah, it's very easy. Okay, if you have, like, if you need to give presentation on this or whatever, is simply you can call that when there is a stone movement within our urinary tract, there might occur hematuria. Okay, there might occur bleeding while the stone is moving to our urinary tract. Like there might occur inflammation, because of that bleeding might occur. So when the bleeding occur in our urinary tract itself, then when we urinate, what we happen is that our urine might be affected with the presence of the blood, or that can be seen. If it can be seen with our naked eyes, it is gross. If it cannot be seen with our naked eyes, it is microscopic. So number 2 point is done. So next, frequency or dysuria are common complaints of patient with stone lodge in the intravesical segment of the distal ureter and may be mistaken for the symptoms of cystitis. So this is also very interesting. So this kind of symptoms, also clinical features, also you will see, okay, in a person who have renal stone. So frequency or dysuria. So what was dysuria? What was dysuria? Finisha, what was dysuria?
Burning sensation during maturation.
Yes, burning sensation during micturition, or that means जब urinate करते ही you will feel pain. Okay, means pain while urinating, or like all this you will see. Okay, burning sensation and all these are the common complaint of the patient. Okay, those patient with stone lodge in the intravesical segment. So what is stone lodge? LODGE. What is stone lodge? Any idea? Because it is said now, when the stone is lodged in the intravesical segment, then a person will feel pain, this dysuria, pain while urinating. A person will feel pain or burning sensation. So what is stone lodge? Any one of you? Stone lodge. Even if it is not perfect, the answer, if you, I just want to like have a glimpse that you all have any idea or not. So what is this lodge? Stone lodge. LODGED. Any one of you? Any idea? Stone lodge. Any one of you? Samuel, you have any idea what is stone lodge? If no, also no problem.
No, ma'am.
Okay, what about other? Srijana, any idea?
Maybe formation or form.
Okay, what about others? Ilasara, you have any idea about this? Because when the stone
No,
is
ma'am.
lodged, understand, you should know all these things, because you are mentioning na, so when there is a stone lodge hone se you will feel dysuria. So in that you need to know, otherwise if you won't know, it's of no use. So stone lodge means na, when the stone is stuck, lodge means stuck, when the stone is stuck in one or both your ureter. Okay, ureter means what? Ureter was the tube, is not it, that used to carry our urine from the kidney to the bladder. Okay, so when the stone is stuck in one or both the ureter. Okay, so ureter, you know now what part of ureter? I think you know what is ureter, so no need to explain. So when the stone is stuck in our ureter, okay, in one of the ureter or in the both the ureter, okay, when it is stuck, so that is known as stone lodge. So stone lodge in the intravesical segment. So what is intravesical segment? All these were explained about the intravesical. What are the portion of ureter? All these, like physiology, anatomy, all these. All of you, ureter, portion of ureter and all were explained. Just a vesicle portion, all those. You have any idea? If no, I will explain. You just need to respond. Do you know what is intravesical segment? Maximum of you are silent. That means you all know. Okay, let me ask the question. What is intravesical?
No, ma'am.
Then why you all used to be silent then? Where now, from now onwards, silent means you are very expert. You know everything. Okay. Frequency or dysuria are observed of patient with stone lodged in the intravesical segment of the distal urethra. So there are two portions of urethra, okay? There are two portions of urethra. Remember, there are two portions of urethra, okay? The part that is outside the bladder muscle is known as juxtavesical portion. You can write it down. There are two portions of urethra, U-R-E-T-E-R, urethra. The part that is outside the bladder muscle. The part that is outside the bladder muscle is known as juxtavesical. Juxtavesical. Juxtavesical portion. While inside is known as the intravesical portion. While inside is known as the intravesical portion. While inside is known as the intravesical portion. So from this only you need to know the anatomy, physiology. You need to be very clear in order to know all these things. Once you are clear, now you will understand everything. So intravesical segment of the distal urethra. That means like in the intravesical segment of the distal urethra, okay, the stone is stuck. The stone is stuck. So when the stone is stuck in the intravesical segment of the distal ureter, at that time, what happens is that you will feel the feeling of this dysuria, frequency, all these things. So that is why you need to know intravesicular segment. So are you clear now what is intravesicular segment? This was the what? This was the portion of ureter. It's not it, the inside portion of ureter. The outside portion, the outside the bladder muscle was known as the juxta, and the inside is known as the intravesical. So when the stone are present in this intravesical segment, that is in the portions of the ureter. So what happened is that means mainly in the distal ureter, okay? Means in intravesicular segment also there is a distal ureter. So in the distal ureter, when the stone is stuck, then what happened is that you will feel this dysuria and then frequency of urination, all these things. And then sometimes what happened is that these dysuria, frequency of urination, all these things, now they used to be mistaken with the symptoms of cystitis. So they used to think that maybe it is because of cystitis. A person used to have a symptoms of dysuria. So they used to, like, people used to mistaken that maybe. So what is cystitis? That was the inflammation of, Samuel, inflammation of?
Ma'am, bladder.
Yes, inflammation of the bladder. Okay, some people used to tell like this, that maybe this is because this intravesical segment, this is the, what happened is that this is the, like, inside the bladder muscle. Okay, inside the bladder muscle is known as the intravesicular segment. That's why people used to get confused. Maybe there is a inflammation of this bladder, that is the reason why the dysuria used to occur. But no, it's not like that. It is because of the stone that is stuck in the intravesicular segment, not the inflammation. इन्फ्लेमेशन का वजह से ये डायसूरिया नहीं हो रहा है. ये तो जो स्टोन था वो हमारा इंट्रावेसिकुलर सेगमेंट दैट इज डिस्टल यूरेथा पे स्टक होने का वजह से this dysuria occurs. So are you clear with the 3 point? Number 3 point?
Yes, ma'am.
Yes, ma'am.
Okay. So next point, number 4. Number 4, abdominal pain, tenesmus, and rectal pain may occur with a stone in the renal pelvis and often are accompanied by nausea and vomiting. So all these clinical features, that is sign and symptoms also you will see again, okay? Means when a person have the renal stone, okay? That is mainly when the stone is present in the renal pelvis, okay? In the renal pelvis, when the stone is occur, then you might feel abdominal pain, tenesmus, and rectal pain may also occur, okay? So, and these are often accompanied by nausea and vomiting. That means there is a like chances of having this when you have abdominal pain ना, जब abdominal pain होता है, there can also be a chances of developing this nausea and vomiting. Accompanied का मतलब है उसके साथ साथ abdominal pain होने के साथ साथ nausea and vomiting होने का chances है. And then again the tenesmus. When you have tenesmus, that can also be accompanied by nausea and vomiting. जब rectal pain होता तब भी like it can also be accompanied by nausea and vomiting. It's not like when you have abdominal pain you will also feel nausea and vomiting. It's not like that. It is written and often are accompanied. Like हो सकता है chances. You want to ask anything from number 4 point? Any meaning that you don't understand?
Ma'am.
Yes.
Ma'am, tenesmus.
Tenesmus. Oh, tenesmus, right. Oh, tenesmus
Tenesmus.
is like you can what to say, like you can simply call tenesmus means cramping rectal pain, or means you can simply understand like this. You are it give us a feeling, okay, that you need to have a bowel movement, or else you can simply call like sensation of being unable to empty your bladder, means sensation of being unable to empty your bladder. You can say like that. और simply अगर फिर भी तुम समझ में नहीं आया तो you can like simply say like that a person will feel like passing the stool, okay, even though his or her bowel are already empty. ऐसा भी बोल सकता है. It relate to both it mainly relate to bowel movement, okay, bowel movement जो stool pass करता है ना, मीन स्टूल पास करने का बहुत मन होता है, लेकिन क्या होता है कि हमारा जो बावल है ना वो ऑलरेडी एम्प्टी है. एम्प्टी होने का बावजूद भी तुमको फील होगा कि you have to means pass, or you have to you have to have a bowel movement. So are you getting this, tenesmus? Or else I'll explain once
Yes,
again.
Ma'am.
All of you?
Yes, ma'am.
Okay. बस ऐसा समझो हाँ कि you just understand like this, that a person used to feel like means to empty the bladder, or to feel to pass the stool even though his bowel is already empty, or a sensation of being unable to empty your bladder like that. बस ऐसा फील होगा कि ब्लैडर एम्प्टी है लेकिन एम्प्टी नहीं हो रहा है, फिर भी you want to pass the stool, or these are mainly the meaning of tenesmus. That kind of feeling na, if you have, you might have, if you have means if the stone is present in your renal pelvis. This time the renal pelvis, all of you know now what is renal pelvis. Renal pelvis means it is the function, you know, this renal pelvis, what does it mainly do? Our renal pelvis, it mainly function as a funnel for urine, okay, it mainly function as a funnel for urine flowing to the ureter. So funnel तो you already know, वो ट्यूब का जैसा, पाइप का जैसा एक करता है. So this is about renal pelvis, means when the stone is stuck or the stone is present in the renal pelvis, you will have or feeling or sensation of abdominal pain, tenesmus, and rectal pain. So you know now what is rectal? You know what is rectal? Rectal में pain होगा. So you know what is rectal?
No, ma'am.
Anyone have any idea what is rectal? Can you please share what is rectal? Anyone? Any one of you?
No,
Any one of you? Do you know what
ma'am.
is
Pain in rectum.
okay? Say.
Ma'am, pain in rectum.
Yes, this rectal pain. Yes. So what is rectum? Rectal. Rectum was same. All of you know what is anus?
Yes, ma'am. Anus का सामने.
Anus का सीधा सामने पे. Just before reaching the anus, okay, there is a rectum. Are you clear?
Yes, ma'am.
Yes, ma'am.
Yeah, you mean this rectum na, this is like in our digestive tract. Okay, this is rectum is also one part or one section of our digestive tract. ये हमारा digestive tract का एक section है rectum, हाँ, that is present just above the anus. So जो anus means what? Where we pass our stool is not it. जो भी potty करते हैं we do with this our anus. So whatever food it is being digested, okay, from it goes from out from large intestine and then finally it pass out into our anus. So and that just before that, this just above the anus there is rectum. In that rectum there can also be pain when the stone is present in the renal pelvis. So that was all about number 4 points. So are you clear with 1, 2, 3, 4 point?
Yes,
Yes,
ma'am.
ma'am.
Okay, renal colic. Renal colic with flank plane radiating to the inguinal ligament, urethra, labia, testis, or pelvis. So testis or pelvis. These are pelvis, okay? If your notes is if there is any mistake in your notes, you try to correct. Renal colic with flank pain radiating to the inguinal ligament, urethra, labia, testis, or pelvis is type of stone in the mid-urethra. Is typical of a stone in the mid-urethra. That means renal colic with flank pain means like there will be a renal colic, okay, with the flank pain. This kind of symptoms you will see in a person. Renal colic with the flank pain. Renal colic, you know na? You know now what is renal colic? Renal colic, renal itself what? Renal ka matlab kya hai?
Kidney, ma'am.
Yeah, so renal colic with flank pain. Renal colic with flank pain. Renal colic means it is a type of pain, okay, you get when the urinary stone used to block, okay, the part of your urinary tract. So that is all about the renal colic. Simply bolo कि it is a type of pain that you mainly get when the stone used to be present in your any part of your urinary tract. So renal colic, stone here, renal colic. So renal colic with Srijana, please take attendance. Renal colic with flank pain. तो flank pain तो सबको पता है flank क्या है. I already explained. Renal colic with flank pain, and that pain will radiate to the inguinal ligament, and then that pain will radiate to this inguinal ligament and then to your urethra, labia, testis, or pelvis is typical of a stone in the mid-urethra. So renal colic, all this flank pain and all, na, like because of the stone that is present in your urinary tract, okay? So in your means urinary stone, जो urinary tract में stone present होता है, that is known as urinary stone, okay? So when the urinary stones are present, okay, in your urinary tract, so तब क्या होता है कि you will feel pain. Renal colic means urinary this stone. You will feel flank pain, and that flank pain will radiate to your inguinal ligament. That means there will also be pain in your inguinal ligament, in your urethra, in labia, in testes or pelvis, okay? So all this. Do you know what is this? I think you know inguinal ligament, inguinal area, you know all those groin and all. Urethra also, you know. This is the like part of the urinary tract. Do you know what is labia? LABIA. क्योंकि जो flank pain है ये labia तक भी radiate होगा बोला. So do you know what is labia?
No, ma'am.
Ma'am.
So labia, you should know all this labia and all. Labia means what happens is that like especially for girls, okay, like in the vagina we have the labia minora and labia majora, okay, like all these are the like part of like especially for like girls we have labia majora and labia minora. So even that part because of this flank pain, even that labia minora and labia majora can also be like the pain can also be radiated till there labia minora and majora. And then again you can, this labia is also simply known as lips, okay, lips, lips. lips. That means the fleshy fold that surround the opening of our mouth. That is oral labia. Oral labia bhi hota hai. So the fleshy fold that surround the opening of the mouth. So all those labia, do tarika alag-alag ka hota hai. So even till that part also, but mainly this labia here, it mainly indicate the labia minora and majora that is present in our vagina. Na? That mainly it indicate that the pain radiate till there. So testis, everyone know now what is testis, especially boys, you know now what is testis? There is nothing to be like shy to discuss all these things, because you are all the like means medically you need to know everything. You know now what is testis? This is the what? What is testis? This is the male sex gland, okay? That is just located behind the penis in a pouch of a skin called the scrotum, okay? It is mainly present there. So even even because of renal colic, okay, there occur a flank pain, and that flank pain, it can also radiate till the testis, So what is the hormone? Can anyone tell me? What is the function of testis? Can anyone tell me what is the function of testis? What is the main function of testis? Because of this stone, renal colic, it can also like the pain also might radiate to the testis now. So what is the function of testis? Any one of you know? Srijana, you have any idea what is testis? The function?
No, ma'am.
Anyone?
Ma'am, producing sex hormone.
Yes, very good. So the testis, it mainly produce and store sperm, okay, and then it is mainly the like it produce mainly the male hormones. What was the name of that male hormone? Oh God, what was male hormone?
Estrogen.
Boys, what is male hormone? What is male hormone?
Test-
What is male hormone?
Testosterone.
Yes, very good. Testosterone is the main hormone, you should know. So that is what like what the testes mainly produce. What you need to know is that testis is the male sex gland, सिर्फ male में होता है, male sex gland that is located just behind the penis, okay? And then what the testes mainly do is that it produces and stores sperm, and also like it is also one of the main source of male hormone, okay? That is the male hormone is the such as like testosterone. All these are being produced. So you need to know this. So even this flank pain, it can radiate till the testis. So and then or pelvis is typical of a stone in the mid ureter. So even till the mid ureter also. So much detail about this also not required. You can simply study like this: renal colic with flank pain with radiating to the inguinal ligament, urethra, labia, testis, or pelvis, etc. You can study like that also. So are you clear with number 5 point?
Yes,
Yes, ma'am.
Okay.
Yes, ma'am.
Next, number 6, acute obstruction by a stone may occur. Acute obstruction by a stone may occur, generating renal colic. Subacute obstruction may occur with few or no symptoms. So acute obstruction by a stone may occur. Obviously, when someone have like kidney stone, na, किसी का like renal stone diseases, kidney stone है, तो there will be obstruction. क्योंकि ऑब्स्ट्रक्शन का वजह से क्या होता है? ऑब्स्ट्रक्शन का वजह से हमारे यूरिन में क्या इफेक्ट होता है? एनी वन ऑफ यू? Acute obstruction by a stone may occur. So because of obstruction, what can affect to urine? Anyone?
Ma'am, Asymptomatic.
Dysuria. Okay, what about, okay, any other? Obstruction. Obstruction होने से urine flow क्या होगा?
Decrease in urination.
Very good, decrease in urination, because that kind of symptoms you will see. That is what number 6 point means. Acute obstruction by a stone may occur. So directly it is not written there will be like less amount of urine flow, but you can know from the meaning, okay? from the word itself. Acute obstruction means, acute means what? Thoda sa obstruction. Acute obstruction by a stone may occur. So agar kidney में stone होने से, if there is presence of stone in the kidney, then obviously if the stone is big or small, whatever it is, there will be obstruction. So that type of feature you will see. So generating to renal colic, renal colic to you already know that was a type of pain, okay, that we mainly get when urinary stone block any part of your urinary tract. So, and then subacute obstruction may occur with few or no symptoms. There can also be subacute. Means subacute means thoda sa acute obstruction may also occur with few or no symptoms. Means like the obstruction that occur is like acute, okay, acute, and then you might find symptoms or you might not find any symptoms. And if symptoms are present, much symptoms are not present. Only few amount of symptoms can be seen. So that is also like. That this is clinical feature number 6. It's not that much important. You can you can just simply write now, like there will be decreased amount of urine flow because of obstruction. In that way also you can write. So with that you can understand more. So are you clear? Number 6 point.
Yes, ma'am.
Okay, number 7, infection. Only 1 minute left. Okay, I'll see whether I'll be able to complete or not. Infection often complicates stone disease and usually produce flank or back pain, fever, and chill, particularly with urinary obstruction. So if infection often complicates stone disease, okay, because you already have a stone disease, okay, with that if there is infection also occur, then what happen is that that will usually produce flank or back pain and even fever, because infection hone se fever hota hai. So fever, chill, all this you will see. You will find if you have stone as well as infection, then this kind of problem you will see the features. So are you clear with all these points 1 to 7?
Yes, ma'am.
Okay. I think the time is going to get over, so I hope you understand everything. Okay, then that's all for today. Okay, thank you everyone.
Thank you, ma'am.